Hello, everybody. I think everybody should be able to chat in the chat. As Zoom so helpfully said at the beginning, this meeting is being recorded. We will upload it to YouTube after the fact, as well as our podcast, so that people can access this information in a few different ways. But as people, filter in a little bit, we'll just give a little overview of us. So, hello, everybody. My name is Bailey, and I'm the Associate Director of Communications here at Beyond Celiac.
Hi, everybody. I'm Lauren, and I'm the social media coordinator here at Beyond Celiac. Super excited to be chatting about unique symptoms with Bailey today.
Yes, and Beyond Celiac is a nonprofit based in the US, and we are the leading funder of, we're like the leading voluntary health organization funding celiac disease research. We're really big into research. We love science, and we love sharing science with our community and also academics. So, this is just another way that we're doing that. And this event would not be possible without Takeda, who are partnering with us on a disease awareness campaign. So thank you, Takeda, for that. Lauren, anything else, or should I dive into classic symptoms?
Go for it. Yeah.
Okay, so first we just need to establish what the classic symptoms are. So in celiac disease, this is weight loss, diarrhea, and failure to grow. So, like short stature, things like that. And in the past, doctors associated those conditions with celiac disease. Therefore, if you didn't have those specific symptoms, you did not have celiac disease. But now, today, after a lot of research and patient input, we know that that's not the case. There are tons of people who have other symptoms or who don't have these symptoms at all. They might have constipation, they might be really tall, they might be overweight, any of that, and they can still have celiac disease. So that's really important myth busting that is still ongoing today.
Yeah. And I just want to also give a disclaimer that patients can have a very wide variety of symptoms. It's kind of like snowflakes, like no two cases of celiac are going to necessarily look the same. And Bailey and I are both patients. I was diagnosed in 2007, and my symptoms have changed since I was diagnosed. And so that's also, something that can happen. Your symptoms can change over the course of your life. In talking about these more quote unquote unique symptoms, we don't want anybody to feel anxious or hypervigilance is something that we come up against a lot with the gluten-free diet. It can be very easy to sort of spiral into anxiety because this is so pressing. But we want you to feel empowered, and perhaps some of these unique symptoms can explain things that have happened in the past for you, or explain current symptoms that you didn't know were necessarily linked to celiac disease so that you can try and find a solution to them. And for healthcare professionals, we also want to empower you to consider celiac disease if you have a patient with unique or persistent symptoms, because celiac disease is a whole system, whole body disease. It doesn't just affect the gut. And so that's kind of what we're trying to hammer home here today.
Yeah. And even though celiac disease is treated primarily by a gastroenterologist, somebody who looks at the gut, it is an autoimmune disease, right? So that means it can affect the entire body. And in particular, celiac disease can affect, as an autoimmune disease, can affect more parts of the body more intensely because of the nutritional deficiencies, right? So different parts of your body use different vitamins, use different minerals, all of that. And when you have celiac disease, it means that your intestines are damaged and aren't taking in all of the nutrients that they have access to, right? So then that means the rest of your body doesn't have the nutrients it needs to function properly. So, what do I mean by that? So, for example, I'm just taking a look at my notes here, but eye health is closely tied to vitamin A, I believe. And so, like, if your intestines can't get vitamin A, then like your eyes maybe aren't working as well as they used to. And some of that might be permanent, and some of it might be temporary. Vitamin C and vitamin K deficiencies can lead to increased bruising and poor clotting of the wounds, so you might bleed for longer. Your gums might bleed more if you brush your teeth, something like that. And obviously, vitamin D is a huge one. You know, it might mean that you have weak bones or are more prone to fracturing. It might mean that you're at an increased risk for osteoporosis. But I'm getting ahead of myself. I'm going into a lot of things there. We will talk about a few of those symptoms in more depth in a little bit. And also, we got quite a few questions, so we will be answering specific questions about specific symptoms at the end. However, Lauren,
I have one more disclaimer to give, and that's that Bailey and I are not doctors. We are employees of this wonderful organization, Beyond Celiac. We do have a wealth of knowledge, but we are not medical professionals, so we cannot give medical advice. And so, in answering some questions that you all have submitted, this is not medical advice. This is our knowledge as it relates to celiac disease, sort of in this field. And if you have questions related to your case specifically or medical questions, you should definitely ask a doctor. So I can dive into the beginning of our some of our symptoms. So as Bailey mentioned earlier, a classic symptom of celiac disease is diarrhea. But irregular bowel movements as a whole are certainly a symptom of celiac disease, and we talk a lot about poop at work, which is kind of a silly side effect of our jobs. And so we wanted to mention constipation as an untraditional symptom of celiac. Constipation is passing fewer than 3 stools a week or having a difficult time passing a stool. It is treatable, and it should resolve itself on the gluten-free diet. Kathy V asked if chronic constipation ever gets better. And yeah, it should. If you're finding that it is not resolving itself on the gluten-free diet, you should definitely talk to your doctor because it could be a sign of gluten exposure. It could be a sign of not enough fiber in your diet. There's other things that constipation obviously can be related to, as well as other types of irregular bowel movements. So definitely worth checking that out if that's something you're experiencing while on the gluten-free diet. Pass it back to you, Bailey. We can just go back and forth.
yes. Um, Another unique symptom that a lot of people might not think of off the top of their head is poor teeth health. So, specific issues include discolored teeth. So, that means there might be white, yellow, or brown spots on the front and back teeth, the incisors and the molars. They might be damaged enamel. So, enamel is a tough protective outer layer on your teeth. And when the enamel is damaged, it makes it easier to develop cavities or other damage. And then also, we're going to throw mouth ulcers in there. So, these are like cold sores, or are they called something else? And I feel like there might be a regional thing, but essentially they're small, painful sores in your mouth. They usually disappear on their own and aren't like that serious, but they are kind of irritating, especially if you're drinking like something that's a little sour or like has a little acid.
The word
Um,
I think you're thinking of is canker sore, right? Is
Canker
that the
sore,
other?
yes,
Yes. Yeah, yeah.
yes, thank you. Um, and citing some studies. A study from 2025 found enamel defects in 27% of patients with celiac disease versus just 4% of the patients without celiac disease. So that is like fairly common condition, right? That's like 1 in 4 people with celiac disease have enamel defects. Um, this is more common, I believe, in pediatric patients, right? Because if you don't develop celiac disease until later in your life, you know, your adult teeth have already come in. But when you're a child, it is particularly important to maintain your dental health. So, again, citation: dental enamel defects can occur if celiac disease develops while permanent teeth are forming in children under 7 years old. Tooth defects resulting from celiac disease are permanent and do not improve once a diagnosed person adopts a gluten free diet. Um, but the mouth sores should go away on a gluten free diet. But the
Nice.
coloring, if you have discolored teeth, you might just be stuck with it. But honestly, I think that adds a little character, right?
Yeah, I do
I'm
think
not
we put a lot of like aesthetic value for kind of no reason on teeth, which is funny. I agree. I feel like different teeth is, yeah, as long as it's medically like everything's okay, I think it's totally fine.
Hmm.
Um, so gonna stick in kind of this like mouth region of the body, and move to geographic tongue, which is also known as migratory glossitis, and it's inflammation with bald patches on the tongue. And the bald patches are from the bumps on your tongue are called papillae, and when geographic tongue happens, these bumps go away, and so these sections of the tongue feel smooth, and it can change even like day to day. It's not serious and it's not treatable while it's happening, but it does disappear on its own and can flare up again. And it's also not contagious. It's just like something that is occurring. And to my understanding, it's they don't really know why, like it's just an inflammatory reaction. I used to work at a coffee chain, and the egg bites were like the only thing I could eat on my shift meal, and I didn't realize that people were using the same tongs for the egg bites as they were for the pastries, and so I was getting glutened a lot and I didn't know. I was like having all of these symptoms build up over this one summer, and one of them was this geographic tongue. And I was like, oh my gosh, like, do I have cancer? Like, what is this? This is crazy. And it turns out it's just a symptom of celiac and a not serious symptom of getting gluten. But yeah, it does go away if you continue on the gluten-free diet. And one study from November of 2016 found that 15% of people with geographic tongue tested positive for celiac disease, which is kind of an interesting, like, it's pretty linked to celiac in that way. And it is also associated with psoriasis, which is another autoimmune condition.
Yeah, so many of the autoimmune conditions, genes are just associated with each other. It's this like complex web that you're sort of picking through. Um, yeah, I also, does it, are you sensitive to spice? I've heard that
Me?
having geographic tongue, yeah, can make you sensitive to spice when it's trying to.
I'm not, I don't really have it anymore, but I like wonder, yeah, I that's so interesting. That makes sense. I feel like if parts of your tongue are like sensitive at, at any given time, that yeah, it would be like, or like acidic stuff would probably be tough
Yeah,
too. Yeah.
yes. Um, Okay, well, moving on to our next symptom. Our next symptom is called dermatitis herpetiformis, which is a skin rash that is associated with celiac disease. And you only have dermatitis herpetiformis if you have celiac disease. So it's a symptom specific to this condition. And it is a chronic symptom of celiac disease. So if you're getting exposed to gluten or if you're not sticking to the gluten-free diet, you will experience DH flare ups. And it will only truly go away if you are on a strict gluten-free diet. However, this is one aspect of celiac disease that actually has a treatment. There are specific steroid creams that you can rub onto the rash to reduce the itchiness. Because I personally don't experience this, although one of our colleagues with celiac disease has DH, and it is reportedly extremely itchy. So in the 70s and 80s, this rash was actually sometimes referred to as the. Wait, do I have to censor this because it's going on YouTube? It was referred to as the suicide rash because it was so itchy that some patients could not find relief. But luckily, there is relief today. We have creams, we have ways to deal with this. Um, and I promise it will go away on a strict gluten free diet. It often shows up on the like joint areas, so like your elbows, your knees. It can also show up on the buttocks. And it's called dermatitis herpetiformis because it looks similar to herpes, apparently. So that's why the herpetiformis is there. But yay for treatment. This one has a treatment, thankfully.
Yay for treatment. Yeah. And we had a question asking if spontaneous hives can be related to celiac. And so I just wanted to link these together because it is so interesting that again, we like associate this condition with the gut, that it presents on the skin for a lot of people. But there was a 2006 study of this woman who had what they call urticaria, I think, chronic urticaria. And that I found a few case studies like this where this presenting rash and GI issues both resolved once people went on the gluten-free diet. And then the Cleveland Clinic found that 1 in 5 people who develop chronic hives have an autoimmune disease. And so at least there is some link. Obviously, the skin is your largest organ. And so it does make sense that autoimmune conditions would present outwardly like that. But I just thought that those were interesting and answered, yeah, this audience question that we got.
Yeah, so we don't have a definitive connection between celiac disease and hives, but there is a case study that connected the two, and also hives does appear to be connected to the immune system in some way. Um, so on to the next one. This is a big one, the neurocognitive symptoms. So that includes brain fog, migraines, depression, anxiety. So brain fog is often described as like confusion or struggling to process things, difficulty remembering things. Migraines are a type of really intense headache. Although, Lauren, you have migraines, correct? So maybe you could speak to that more than I could.
Yeah, I get
Mhm.
migraines with aura. And so mine have a visual component and then my half of my body will go numb. It's like this like stroke-like symptom. It's very strange, but migraines present differently for different people. There's like stomach related migraines. And yeah, often it does come with like a like painful headache, but also just this like inability to be taking in information really. Like everything feels very like overwhelming and overstimulating.
Yes, and in I can't speak to migraines necessarily, but for brain fog is extremely common. We Beyond Celiac did original research. It was a survey in back in 2012, I think, and at that time, 90% of respondents reported that they experienced brain fog as a symptom of celiac disease. So that is just exceptionally common. Um, and the depression anxiety aspect of it is a little more difficult to parse through because, yes, it can cause depression and anxiety, but is the depression and anxiety because of this new diagnosis and having to give up a big part of your life and maybe struggling with the socializing aspect of like having a gluten free diet and being able to go out and party and things like that, or go to family events, all of that. So, is the depression and anxiety caused by the actual physical uh, effects of celiac disease, or is it caused by the psychological and social aspects of the management, which is the gluten free diet? And the answer that a lot of scientists have found is it's a little bit of both. Um, we are currently, Beyond Celiac is currently funding research out in Sheffield, UK, and they have found that people with not just celiac disease, but celiac disease and gluten sensitivity um, have different brains. Like for some reason, somehow there are effects on this condition to the brain, and it was a pretty groundbreaking study. If you want to learn more about that, we can send additional information. But that you could just go to YouTube and look up "Your Brain on Gluten." Um, Ian is a great presenter and he talked all about the study, but we have continued to fund more of that so that we can learn more about what those changes are and whether they're reversible and anything like that. Lauren, any thoughts?
Yeah, I think that you really summed it up. I think that with the depression and anxiety piece, like and this different brain sort of thing, we know that celiac does change the brain in some capacity, and we're not really sure all of those mechanisms yet. But I think that that video, Your Brain on Gluten, is really worth a watch. I find that a lot of times our community feels very seen by these things, even though they are a little bit like jarring to be like, oh my gosh, my brain has been affected by this thing that I have. I certainly felt a little bit more understood perhaps, even though again, yeah, it's like you don't always wanna be hearing this stuff. It is validating in some ways to know that it's perhaps coming from somewhere explainable and that other people, are experiencing the same thing. The video is called Your Brain on Gluten, and even if you looked up Your Brain on Gluten Beyond Celiac, and Bailey put the link in the
Yes,
chat, so we
I
can
just put the link
send
in
this
the
out
chat.
after as well.
It's got like 16,000 views. Like I said, Ian is a great presenter and an amazing researcher. We're so happy to be working with him on this really important work. And we also want to emphasize that the neurological symptoms can get better on the gluten-free diet. I certainly, all of my brain fog disappeared once I went gluten-free. And the depression and anxiety thing, it sort of comes and goes. And it was certainly worse in the first, I would say, couple of years on the gluten-free diet as I was figuring out. So I was diagnosed in 2018, and I just feel like I've gotten a hang of it now. My home is entirely gluten free, so it feels very safe. All of my friends and family are at this point, after a lot of like explanation and working together, are very understanding. So I'm in a better place now with all of that than I was initially. Yes. So moving on to another more specific aspect of neurological symptoms, seizures can be associated with celiac disease. And I do want to make a distinction here between seizures and epilepsy. So, epilepsy is a specific condition characterized by having seizures frequently, and epilepsy can be autoimmune in nature. This is different from just having a seizure. So, people can have seizures for a wide variety of reasons. And some of them are temporary, some of them are not associated with a long term condition. Um, this one is sort of unique in terms of celiac disease, and we're still learning a lot. But as I was doing research on this, I actually found a study that went back to like the 1970s on this. But a lot of those initial studies were case studies. So, case studies look at one or two specific patients, and while they can be interesting, they are generally not as comprehensive or uh, how do I say this, Lauren? They just it's usually better to have a larger population size, right? A longitudinal study, so that would be over the course of multiple years with a few thousand patients, is generally better for data and finding trends in specific conditions than just looking at one or two people, right?
More
But
people is more information. So,
yes, more people is more information. Thank you so much.
yeah.
But a few of these studies found that among epilepsy patients who also had celiac disease or gluten sensitivity, 59% presented with focal seizures. According to the study authors, these associations could indicate that certain areas of the brain may be more susceptible to damage than others in patients with both epilepsy and celiac disease. So, the interesting takeaway there for me is that there are specific brain areas that might be more associated with celiac disease symptoms than other areas of the brain. And identifying these specific seizures that are associated with people who have symptoms related to seizure related symptoms for celiac disease can help us identify those brain areas. Does that make sense?
Totally. It's so interesting. I feel like, yeah, as research continues to develop, I really do feel like we're seeing celiac be identified as more than just a GI disease. And yeah, it's just fascinating. I think we're going to continue to see interesting
Yeah,
research.
yes. And a study from 2016 found that about 6% of patients with epilepsy tested positive for celiac disease. And in these patients, the gluten free diet was effective for managing seizures, which is fascinating connection. I do also want to emphasize, though, you should not try the gluten-free diet to cure seizures or epilepsy. That is not what we're saying. We are only saying that we are simply telling you about a study that found patients with epilepsy and celiac disease found that the gluten-free diet was effective for managing some aspects of their seizures.
Yeah, and I think that's also a good time to say too, if you perhaps have not been diagnosed with celiac and suspect that you have celiac, maybe even based on some of these symptoms, it's super important to not start the gluten-free diet until you are seeing a doctor and pursuing a diagnosis, and starting a gluten-free diet under a doctor's suggestion or prescription. Because if you begin the gluten-free diet before you pursue diagnosis, your diagnosis might not be able to come through because there needs to be levels of gluten in your system for your body to react to it. So that's just my PSA there. Um,
Yes. Well, I actually could talk about seizures for a long time, but I am not going to. I'll simply drop a link in the chat if you want to read more about the connection. But let's move on to peripheral neuropathy or numb
yeah.
limbs.
You got it. Yeah. So peripheral neuropathy is the official term for this sort of pins and needles to numbness feeling in one's limbs. And Barbara, audience member Barbara asked if neuropathy in the feet is a symptom of celiac. Yes, it is. In one of our Go Beyond Celiac Insights surveys, 47% of respondents reported tingling or numbness in their hands and feet, which is fairly common. That's almost half of patients. Um, I certainly experience peripheral neuropathy and tingling in my hands and feet. Symptoms are known to begin slowly and in a specific area and then spread and intensify. And that can both begin in its original state, like the first time that you experience it, it starts in one area and then begins to grow over, the course of time. And also, if it comes and goes, it can start in one area and then sort of move up. Um, Ron asked about neuropathy related to celiac and feeling occasional neuropathy after going gluten-free, or if this is a potential reaction to accidental gluten. It certainly could be related to gluten exposure. Unfortunately, neuropathy can also be permanent, and this is definitely something worth seeking care from a neurologist, or perhaps talking to your gastroenterologist, or your primary care physician about. Because it is known to persist and sometimes worsen. And it's also something that can happen with age. And so I think that that's why it's important to continue to talk to your provider about your symptoms, because they can kind of help you navigate if something is celiac related, if something is related to something else undiagnosed that's going on, if something is related to being a person with a body and then managing that feeling so that it's not uncomfortable or painful. Yeah, that's kind of what I've got to say on
Yeah,
peripheral
and
neuropathy.
I think
Bailey, do you have
it's important to know, you are the expert on your body. You know what your normal is, and
Yes.
I think it's really important to understand what your symptoms are and what symptoms are associated with celiac disease, that so that it's easier to identify if, hey, this is probably just like a flare up related to celiac disease, or this is not my normal. This is something different, and I need help figuring out why this is happening. Um, okay, we good to go on to the next one. All right, so the next one is ataxia. So you could also think of this as poor gait or poor balance. Ataxia causes clumsiness or loss of balance and coordination that is not due to muscle weakness. So usually people suffering from ataxia have trouble using their fingers, hands, arms, and legs, as well as trouble speaking and moving their eyes. They also may feel off balance or have trouble walking. And in that survey, again, that we mentioned, this was a big survey for us, and this might have actually been one of the first times that we ever published in an actual journal or presented at we conferences. But anyways, um, In that survey, about 26% of respondents reported trouble with muscle coordination or ataxia. So that is fairly common in about 1 to 4 patients. This can resolve on a strict gluten-free diet, but it also may persist. And it's generally recommended that if you are having trouble with ataxia, you get a referral for physical therapy to ensure that you continue moving the way that you want to move. All right, I think that's all of our neurological symptoms, right? That it's a big category and it can be kind of scary, but have hope. A lot of these symptoms do disappear on the gluten-free diet.
Yeah, and again, it's hopefully validating, if anything. I certainly feel like learning about this all was validating for me. So the next symptom we're going to talk about is night blindness, which is also called this is a lot of big words for me today. Nyctalopia,
Yes.
which is when you cannot see well in the dark or dim locations. It is treatable, and it's linked to nutritional deficiencies. It can be caused by nutritional deficiencies like vitamin A, which I think Bailey mentioned earlier in this call. And so in cases of celiac disease and night blindness, that could disappear when the intestine heals and one is able to absorb vitamin A again. A 2013 study I found on Dutch patients recently diagnosed with celiac disease found that 7.5% of these patients had a vitamin A deficiency. Interestingly, in this study, the vitamin A deficiency was the least common deficiency found, and the most common was zinc deficiency, which was about 67% of newly diagnosed patients had a zinc deficiency. So something to remember is especially if you're a recently diagnosed patient with celiac, it's worth talking to your doctor about getting other tests done to see if there's any vitamins that you maybe could increase over the course of that healing process. Other eye conditions that can be related to celiac include dry eye, Beteau spots, which is like silver gray spots or sometimes triangles that form on the whites of the eyes. Blindness, if the vitamin A deficiency progresses into vision loss, which is rare, but it can happen. Cataracts, which is another thing that can happen with age. Again, it's important to talk to your doctor about if something is celiac related or not. And then uveitis, which is inflammation of the uvea in your eye. And another way to get more vitamin A is by eating carrots, pumpkins, sweet potatoes, squash, spinach, meat, and eggs. And so that's something I definitely try and think about when I'm, grocery shopping and things like that is like where can I be getting more nutrients, particularly for things that could be related to celiac.
Yeah, and again, just want to emphasize the importance of follow-up care with celiac disease. Um, Obviously, when you get your diagnosis, that is really important for answering a lot of questions about maybe why you've been having symptoms or certain things. But it's also very important to go back within 6 months or even in the next couple of years. Actually, they recommend that you go back annually, but because the doctors can they can check on whether your TTG has normalized, right? Whether your immune system is calming down, but they can also look for these nutritional deficiencies and tell you where specifically you might be missing out, so that you can address that issue, either with supplements or with food, and maybe
Yeah.
see a dietitian to talk about your diet. And then once you have that sort of baseline of like, hey, I might be deficient in these things, you can go back every year to make sure you're staying up to date and getting all the things that your body needs to do what it's supposed to do.
Yeah.
Yeah. Yeah. Um, All right, on to the next one, which is tetany or tremors. And this is another one that is usually due to a vitamin deficiency, and that can be vitamin D, calcium, magnesium, and electrolyte imbalance. Um, Tetany is not just like, oh, my hands are shaking a little bit. Tetany is a more serious episode of muscle spasms. It can last from a few minutes to a few hours, and it can include muscle cramps, difficulty breathing, seizures, heart issues, vomiting, and it is luckily easily treatable. If you're having any of those symptoms, you should call a doctor. You should go to the doctor ASAP, urgent care, and they will be able to treat you. So the connection between celiac disease and tetany is these are more case studies. These are case studies, but it did one found spontaneous episodes of tetany in 3 adult patients who were later diagnosed with celiac disease. The original cause of tetany was calcium and magnesium deficiencies, and then after restoring those calcium levels and eating a gluten-free diet, the symptoms of tetany were resolved. There was also a more serious case study of a 2-year-old boy who was admitted to the hospital with muscle cramps and tremors, as well as reports of chronic diarrhea. And it found that the tetany was a feature of celiac disease. It was caused by that severe calcium deficiency. And once the boy went on the gluten-free diet and got his levels all back to normal, he did not have any more issues with it. So it's treatable. Yay.
Yeah, that's pretty
We love that.
interesting. We do love that. Okay, moving on to another question from our audience. Maria asked about fatty liver disease and a connection to celiac disease. And I found an interesting 2022 study that showed that 0.7% of the celiac patients in the study had metabolic dysfunction associated steatoic liver disease, which is also MASLD, and also called non-alcoholic fatty liver disease. And then sort of in response to that 2022 study, I found an interesting 2023 study that recommended those with MASLD be tested for celiac. And this kind of reminded me of iron deficiency. We see often that if a patient has unexplained iron deficiency or anemia, that it's recommended that they be tested for celiac if they haven't been, because that is often linked to celiac, like we continue saying the nutrient deficiencies and things like that. But there's also a thought that people with celiac disease might be predisposed to autoimmune hepatitis, which is liver damage that occurs when your immune system attacks your liver. And the prevalence of celiac in people with autoimmune hepatitis is around 4% to 6%. And so, yeah, it's just an interesting, like, we're still kind of establishing the link between liver disease and celiac disease, but there is certainly a potential for a connection. So something to be aware of, especially if either of those are in your family. Yeah.
Yeah, the connection between celiac disease and the liver is, or rather, the liver and the immune system, is an interesting one that we're still learning about. There is a drug in development for the treatment of celiac disease. And the way that it works is it actually goes through your liver. And then it induces, or it's still being studied, but in those studies, it displayed efficaciousness.
We know something is going on there. Also, great word. That was really good.
Thanks.
Yeah. Yeah, we know
Um,
there's some connection. Yeah, it's interesting. Something to monitor.
it's all connected. Um, wait, I don't mean that in a scientific sense. I was just joking with Lauren. But the body's all connected. Okay, so on to the next one. This is an interesting one for me. I've always been fascinated by it, but it's Ehlers-Danlos syndrome. Lauren, have you heard of this before?
Yes, I have. I think it is also very interesting, and it's another condition that presents in like a million billion different ways for people.
Yes, yes. Okay, so what is it? We're going to refer to it as EDS, but Ehlers-Danlos syndromes. It's a group of 13 inherited connective tissue disorders. So there's like 13 different types of it that we've identified so far. But all of them are related to abnormal structures in the connective tissues and collagen. So that means like just like the tissues in your body that pad everything, right? Common symptoms in EDS include overly flexible joints to the point of frequent and accidental dislocation, persistent pain, fatigue, fragile and easily bruised skin, to the extent that in some EDS patients, stitches may not work because the skin just breaks, and structural weakness of the blood vessels and organs, which can result in hernias and hemorrhages. So that's why it can be really important to get diagnosed so that you know to look out for those things that may happen unpredictably. So, what is the connection between celiac disease and EDS? Now I'm gonna take you on a little bit of a journey here. Okay, I'm gonna take you on a journey. So we do have this study that found those with celiac disease have a 49% increased risk of EDS than those without celiac disease, and the opposite is true as well, that people with EDS are more likely to have celiac disease. However, that was a study done quite a few years ago in Europe, and there was a study, a longitudinal study published in 2025. It was the first large scale study on the connection between celiac disease and EDS in the United States, and they posited that some of the older studies maybe didn't take into account aspects of like autoimmune conditions or how to exclude certain people. But even still, this study from 2025 found an 8.93-fold increase in the odds of CD individuals being diagnosed with EDS compared to controls. So, although the connection between the two is not as large as it was previously thought, there is still some connection of like people with celiac disease are more likely to have EDS and vice versa. The authors of this 2025 study posit they suggest that a potential explanation for this connection is that due to the weak tissues associated with EDS, right? You have weak tissues throughout the body, that maybe people with EDS have an increased chance of gut permeability, right? So maybe like people with EDS, because they have weak tissues, their gut is leaky and it's letting things through. And then this is setting off the immune system to spark celiac disease. Um, but that is not confirmed. That is just their potential explanation for why this might be occurring. But as with anything, more research is needed. At the very least, multiple studies have suggested and pointed out some sort of connection between the two conditions. So if you are hypermobile and you have celiac disease, if you're like, wow, look at this, I can do, I'm not hypermobile, but if you can like bend your fingers back really far, maybe talk to your doctor about learning more about EDS.
Yeah, and although it is chronic and does not have a treatment currently, there's a lot of management tools that are available for EDS, as well as I think that EDS is often managed by community support, and I think that having a name for a condition like that is very helpful to be able to connect with people and find support in that. And so, yeah, I think it's another reason to talk to your
Yes.
doctor about it.
Yeah, that's another one that I could go on for a long time about, but I'm not going to, especially because okay, we only have one more symptom to talk about, and then we're going to get to the questions. We had a lot of great questions. So, Lauren, why don't you talk
Yes.
about the last symptom?
Okay, so the last symptom is being asymptomatic, which can also be called having silent celiac disease. And this presents as having no symptoms. You can still have chronic celiac disease and experience intestinal damage when you eat gluten, even if you have no presenting external symptoms. I have a bit of a caveat here, which is that often the silent cases of celiac end up realizing later that they did have symptoms. They just did not present in the classic manners that Bailey described earlier. And so these cases are often found through screening, which is a really big reason that screening for celiac disease is very important and is a big initiative that we are pushing here at Beyond Celiac because you can't get diagnosed if you don't get tested. So screening is a way to bring testing to people who maybe would not have pursued a diagnosis.
Yeah, and just in case anyone's not familiar with that specific term, screening means testing everybody, regardless of symptoms. Universal screening means, you know, any patient that comes into the office is going to get tested no matter what. It doesn't matter if you have symptoms or not. It doesn't matter if you have a family history or not. You're going to get tested.
Yeah, thank you.
And
And
we
it's
support that.
important because Oh, sorry. You go.
No, you're good.
It's important because it tells us perhaps like a truer, more clear, more true, more clear picture of who in a population could have celiac disease, which is kind of anyone. So yeah, even if you're asymptomatic, especially if you have a first degree relative with celiac disease, it's important to get tested. We recommend getting tested like if as a kid you would get tested more frequently, and then if you continue to not have symptoms into adulthood, every few years is probably fine if you have a first degree relative and are asymptomatic. But it's just important to monitor your health.
Yeah. So let's dive into the questions. I'm so excited to get into questions. I love
Yes.
answering questions from community members. So our first one comes from Julie L, who asked, "Are there any symptoms that longtime patients should keep an eye out for after their celiac disease is under control?" And the answer to this, we talk to our science team. We also have a medical advisory board, and we compile information from all of them. But the answer to that is you shouldn't be symptomatic. So people with celiac disease, the idea is that once they go gluten free and they're on a strict gluten free diet, they will not experience any more symptoms. But we don't live in an ideal world, and glutamines happen. Oh, somebody said I'm a silent celiac discovered by screening in Italy. They will test all the young kids starting January 2026. Yes, we know about this. We have been monitoring this really closely, and initial data has come out, but they haven't published it yet in a scientific journal. And we usually wait to report on things until it's published in a scientific journal, because that way we know that it has been reviewed by scientific academic peers. Um, I'm so glad to hear that the Netherlands is going to start screening as well. We actually have a question about this later, but that'll be later. So, Julie L, you shouldn't be having symptoms. If you're having symptoms, you should go talk to your doctor about potentially sources of where you might be getting exposed to gluten. And unfortunately, there are a portion of people with celiac disease that just the gluten-free diet does not work, and they, no matter how strict they are about it, they just continue to have symptoms, and it's not due to a related condition. It's not due to gluten exposure. They just continue to have symptoms, which is why we at Beyond Celiac are so passionate about um, developing some other treatment, some sort of cure, some sort of drug or therapy that can help those people, or really anybody that wants that. We have a very diverse patient population, and everybody has such different symptoms that we deserve options for how we choose to manage it. Um, but in terms of specific symptoms that you might want to look out for, bone density. That is one that comes up in a lot of patients with celiac disease. A 2025 study found that 23.6% of patients with celiac disease had osteoporosis. So that means that you have weak bones. Your bones are more likely than others to break, to fracture. A 2016 study found among those recently diagnosed with celiac disease, 56.1 had osteopenia and 29.2 had osteoporosis. So those are essentially, osteopenia means that you have weak bones, and osteoporosis is like a more advanced version of that. And a 2005 study found that those with osteoporosis are 17 times more likely to also have celiac disease. The link was strong enough that the project's lead researcher, William Stenson, recommended that all individuals with osteoporosis undergo screening for celiac disease. There's that word again, screening. So everybody with osteoporosis get tested for celiac disease. Um, but it's particularly important for people with celiac disease to go to the doctor, to go to your annual physical, follow up on your tests to make sure that you don't have any nutritional deficiencies. And if you do have a nutritional deficiency, especially vitamin D, which is associated with bone health, be sure that you're getting enough vitamin D in your diet or in your supplements.
Yeah. I concur with all of that. Kind of in this same thought, Valerie C asked us how important it is to have a care team. they were diagnosed in April of this year with no follow-up even when requested, which that is really unfortunate. Follow-up is definitely important, especially in the first 6 to 12 months after a diagnosis, because those blood tests can indicate whether or not the diet is working, and, if you've got the diet down, if it's 100% gluten-free, and that's obviously kind of hard to tell for yourself, without blood work and labs and things like that. Generally, a gastroenterologist will be more familiar with celiac disease guidelines and more likely to get the follow-up needed. Primary care physicians obviously can too, but if you are having trouble getting follow-up from a primary care physician, perhaps seeking out a gastroenterologist, if that's a possibility, would be a good option. And then as for a care team, it's important that all of the individual healthcare professionals that you work with know that you have celiac disease and know that you're gluten-free, what that looks like, what it is. Obviously, a gastroenterologist can treat the GI symptoms. A primary can get the general screening test that you need. A nutritionist can ensure that you're getting all your vitamins, even if you're on the gluten-free diet. If, if it's a child, a pediatric dentist may need to look for teeth issues as the child continues to develop. A wow, I can't speak today. A gynecologist may need to consider how gluten can affect your fertility if that's something that you want to pursue as well. And a nurse in a doctor's office should not give a patient with celiac snacks with gluten after a procedure. Like, everybody needs to know that you have celiac. Unfortunately, this does mean having to advocate for yourself a lot, but fortunately, you learn to become a really good advocate for yourself, which can bleed out into other parts of your life, which I think is awesome. And it can also help to have somebody there with you, a spouse, a parent, or a friend who can push for you and ensure that you're safe. If you're going through a procedure, making sure that there are no gluten-containing snacks after sedation, having somebody there to help you remember what the doctor said. I feel like that's something that is so overwhelming when you're at a doctor's appointment. You're getting so much information. It can be helpful to have somebody else there as part of that conversation.
Excellent, excellent. I clap for you. And I also, just personally as a patient, I do go in every year to get my testing done. And I have a great gastroenterologist, but it took a few years to find that one. But I support that. Um, okay, and let's just dive into this screening conversation really quick, because we've gotten questions about that in the chat, we get questions about it online, and we got questions about it with this town hall. So Kathy H asked, with so many symptoms that could lead to a celiac disease diagnosis, why aren't doctors testing for it more frequently? It always seems to be the last thing they consider after years of coming up with other tests being negative. What can Beyond Celiac do to advocate for more testing? So I do want to put a caveat here that this is going to be mostly United States, America focused. As one person so helpfully put in the chat, Italy and it sounds like the Netherlands are doing this universal screening, right? So that means testing everybody, or pediatric screening, testing everybody for celiac disease. So why isn't this happening in the United States? Let's talk about it. Let's do a little history deep dive. So in 2017, the U.S. Preventative Services Task Force concluded that there is insufficient evidence to assess the balance of benefits and harms of screening for celiac disease in those who do not have symptoms. Essentially, they didn't think that there was enough evidence, enough data to support the recommendation that everybody get tested. In response, Beyond Celiac funded the ASK study, which is a screening study to provide evidence either, supporting their stance or not, right? So the ASK study was in Colorado, and it was universal screening. All the patients who came in could choose to get tested, choose to not get tested, whatever. But what we found from that study is that screening is the only way to find everyone with celiac disease. Other similar studies find similar results. So, from our article on this study, about 70% of children identified through screening did not have symptoms, and about 90% did not have a family history. The study also found that symptoms were not reliable predictors of which children would have celiac disease. Right? So, there is one study that we did supporting the idea that universal screening is the only way to find everybody with celiac disease. We also recently published a study on why and how these delays are happening. So the average delay to a celiac disease diagnosis is about 3 years, and these delays are seen especially in older adults, women, and Hispanic patients, also those living in southern USA, um, because we're also seeing that doctors are not necessarily following the guidelines. So GI groups make recommendations about who and how and why people should get tested for celiac disease. Doctors aren't really following through on this. So what are we doing to address all of this? We are continuing to publish research on this so that we can prevent this data at conferences, so that we can talk to GIs about why this is really important, so that we can talk about primary care doctors and other academics about why this sort of testing is so important. We continue to support screening initiatives like Ask out of Colorado, which still operates, so that we can just continue to collect data on and prove to the U.S. Preventive Services Task Force about why this should be done. So it's still ongoing. We are doing stuff. It's just taking time.
Yeah,
All right.
research takes time, advocacy takes time. Yeah.
Yes. Back to symptoms. Let's see if we can just like speed run this.
Yeah. Okay. So we got a question about a possible link between amenorrhea and celiac, where a sister and a father both are confirmed celiac. And amenorrhea is delayed menstruation, and research does suggest that untreated celiac disease could delay menstruation or cause periods to stop completely. These research studies are case studies, and so that's more individual scenarios. So they could be studied more broadly, but we found studies with a 15-year-old, a 17-year-old, and a 30-year-old where menstruation was all impacted. And this is something that I often hear anecdotally as well, that people with periods and celiac disease have experienced disruption of their period due to, yeah, undiagnosed celiac or gluten exposure. We also got a question about shallowness of breath or shortness of breath being a symptom of celiac. In the sense that it could be a symptom of something related to celiac disease, like iron deficiency or anemia, lung inflammation, thyroid issues. Yes, it could be a symptom of celiac. It's not really something that is directly linked to celiac, but again, if you are having any sort of issues that you're concerned about, definitely worth talking to your doctor about it. Um, and then I can go one more, Bailey, if you want to take
Yep. No,
the last one.
you
Okay,
can
great.
pass it off if you want.
Cool. We got another question about brain fog and forgetfulness. And if people with celiac disease on a strict gluten-free diet, this person was on a gluten-free diet for over 8 years and they're still experiencing brain fog and forgetfulness, if other people experience that too. Yes, those are definitely symptoms of celiac. If you're still experiencing them on a gluten-free diet, it's probably worth it to go talk to your doctor about that, because some of that really should resolve itself. However, some of the research coming out of Sheffield is showing that parts of the brain that are damaged can be permanent damage. Anecdotally, again, like I was diagnosed almost 20 years ago, and I definitely have brain fog and forgetfulness that I kind of now associate with, gluten exposure over the years. I'm sure that there's some sort of relation there, but also there's like a lot of reasons in the environment in the world that I could be experiencing brain fog and forgetfulness. And it's again that like what, if celiac leads to something, does and that issue continues, is that how do we treat the issue? Do we treat the celiac, or do we treat the issue as a separate thing? So I think it's always worth it to bring this back to your provider, and see what their advice is.
Yes. And then our last question, Rob asks, 5 years ago, I suffered a rare stroke with no cause found. This year, I was diagnosed with stage 3 liver fibrosis. And then shortly after diagnosis, silent celiac. Is it possible celiac played a role in my stroke and liver fibrosis? We cannot give medical advice. We can't, we don't know your case study. We don't know what might have caused those. But what we can say is people with celiac disease may be predisposed to autoimmune hepatitis, which is liver damage, and it occurs when your immune system attacks your liver. The prevalence of celiac in people with autoimmune hepatitis is around 4 to 6%. And we hope that helps. We had so many questions, so we could definitely talk about this for a lot longer. We could do more town halls on this topic. But Again, just want to reiterate, this is not to scare anybody. All of the symptoms we talked about, you may have them, you may not. But it's just good to know that what might be connected to celiac disease, what might not be. Talk to your doctors. Get tested if you don't have celiac disease. Don't go gluten free before you tested them.
Boom, 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 boom. Yes.
Boom, 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 boom.
What
Thanks to
she said.
Takeda for allowing us to do this.
Yes,
Appreciate
thank you
it.
so much, Takeda. Thanks,
Um,
Bailey, also. And thank you
Thanks,
to you all for
Lauren.
attending
Yes.
and thanks for listening.
And
Yay.
if any of you have any other questions or want some of the studies that we cited, just reply to the email that will go out probably later this week, and I can send you those studies. I love to share science. Okay.
Yay.
Have a lovely day, everybody.
Have a great day. Bye, everyone.
Bye.